All right, 9:15, 9:16, let me check that. Welcome back. It is a condition that so many women deal with, but the thing is, you might not know it or you really know it. Dr. Kelley Rouse is an OBGYN with Atrium Health, and she's here with us this morning. Good morning, doctor.
Good morning.
So glad to have you here, and I think it's really important that we be talking about fibroids today, but I think we got to kind of set the table a little bit first. What are fibroids?
So fibroids are non-cancerous tumors of the uterus, and they are very common. Unfortunately, more common than African American women. The symptoms associated with fibroids depend on the size and shape. So a lot of women have abnormal bleeding, which can be bleeding more than 7 days a month, bleeding that's heavy that requires you to change a napkin more than once or twice per hour, frequent bleeding, pain and pressure as well.
Do they come in all kinds of sizes?
There are. So fibroids are usually, when women present with these symptoms, are if during your annual exam, your provider asks you questions, and we usually ask questions to try to get to those answers. We do imaging via ultrasound or MRI. Fibroids can be as small as a few millimeters, like the size of a pea, but they can also get as large as the size of a cantaloupe.
Yeah, a friend actually very recently just had several removed that were so large. What is the like, do they grow? Can they start the size of a pea and grow very, very large?
So fibroids usually start growing during our reproductive years, so late 20s, usually mid 40s. Once we enter menopause, the fibroids no longer have the hormone or blood supply they need to continue to grow, so you'll see some shrink in size. But women who make fibroids do a good job of making fibroids. So if you have one, even after treatment, it is possible to have additional fibroids grow. You
mentioned some of the symptoms that people might notice. Can they also be painful, and how do you experience that pain?
Yeah, the pain associated fibroids is due to them getting large and outgrowing their blood supply. When they outgrow their blood supply, the tissue begins to necrose or die, and that's what's painful. So similar to discomfort associated with your menstrual cycle, or if you can recall labor, but that contraction type discomfort that just persists, it persists and it builds. Sometimes it's during your cycle, sometimes it's not even related to flow that's happening, but it's this pelvic crampy discomfort that can limit your ability to do the normal things. So when the discomfort gets to a point where it affects your quality of life, that's when it's important to seek treatment.
So these cause all kinds of problems, not just pain, right? What other problems can fibroids cause?
The biggest thing is the abnormal bleeding. And so there's some women who have accidents. So you expect, you know when your cycle is going to occur, but then there's episodes of heavy bleeding that you don't anticipate, so you're not prepared for that. And then there's accidents, and then there's embarrassment associated with that. And then sometimes, depending on their size and location, fibroids can affect your ability to conceive. If they're in a location where they're blocking the fallopian tubes, or if they block the tubes, difficult to conceive. If they're in the lower part of the uterus, perhaps you're committed to a cesarean section because the fibroid is blocking the outlet, and the baby can't deliver vaginally.
All right, so what do we do about fibroids?
So there's several options. Some are more innovative than others. Traditionally speaking, surgery was the big thing. There are now medical options where there are medications we can take to manage the symptoms, but the medications don't treat the fibroid themselves. There's something new called Sonata that's pretty innovative. It's an incisionless outpatient procedure with a short recovery time. So what happens is, in real time, ultrasound is done in the operating room where the fibroid is visualized. It's treated with a little pin that's inserted, and radio frequency energy is used to treat the fibroid. In doing so, we decrease blood supply to the fibroid, which causes the fibroid to shrink and your symptoms to dissipate.
If people have very large fibroids, is a hysterectomy something that always has to happen, or can we work around that?
We can work around it, and you know, large, it depends on how large is. Sonata works well for fibroids at 6.5 centimeters. Fibroids that are much larger, if they're putting pressure on things, if there are more fibroids than uterus. If the fibroid's in a location where it's not safe to treat with Sonata, then sometimes a hysterectomy is an option. But that is our last ditch option. There's so many other things we can do before we jump there.
Just a few seconds left, but I know, you know, sometimes just getting together with other women and doctors and talking about these things is really important. You have an event coming up.
Absolutely. We're looking forward to it. Imagine Girls Night Out meets Women's Healthcare.
Nice.
Thursday night, 6:30 at the Daily Tavern. Informational session. It's free to the public. We would like for you to RSVP so we can plan accordingly. But the idea is to share, have women tell their stories, offer information. I will be there. One of my colleagues, Dr. Leslie Hanson-Linder, will also be there. We're answering questions. We're providing information. There's food. There's cocktail. It should be great.
So you can ask any kind of question you want, and sometimes you just need to be in the right space to do it. Doctor, thank you so much for helping us out
Thank you for
today.
having
We
me.
appreciate it. Absolutely. All of the information, again, right there, right on your screen. Mr. John Carter, right back over to you.
All